Francine, what is your opinion of the state of the healthcare system in the United States today?
It's become clear to me over the past 2 years, as I've talked to many people in the 50th District, that our broken healthcare system is the most important issue that's actually impacting people personally. From my 25-year-old daughter who falls between the cracks in the insurance system, to small businesses and self-employed who are finding it more and more difficult to keep up with the increasing costs to cover the families, to large corporations that are finding it difficult to remain competitive in a global economy. And of course, our seniors are struggling with the complexities and the costs of this Medicare bill. And so while it may be a local issue, it's also a national issue because of the scope of it. 80% of the 45 million uninsured Americans are working families. We pay twice as much as per person as other developed countries, and yet we're far from providing the kind of access to affordable health care and quality health care for our citizens that we need to do. So Congress needs to look at this and see what we can do to move in the right direction.
What are some of those things that we could do to help solve some of these problems?
Well, right off the bat, working with our employer-based health care system that we have, Congress could do a couple of things today that would take the burden off of our employers. One is to make sure that they have tax credits for covering the cost of health care for their employees and families. The other is to allow self-employed and small businesses to purchase into larger risk pools, just like large corporations, that would lower the cost for them. By lowering the cost, you lower the number of uninsured, and that takes some of the burden off the system. But, you know, we can also look at the states. Massachusetts is doing an experiment now where they're combining public and private resources to make sure that their citizens are covered at the same cost people are paying, but to make sure that that cost is spread so that everyone is covered. And that's the kind of thing Congress needs to have the conversations about.